First, I think the word inviting Africans to the table, I think, is misinformed. It's not about inviting Africans to the table. Why don't we create the table together with the Africans? Why are you inviting them to the table? Why don't we all agree, like we are actually creating this table together? And we feel like the current tables are not fit for all of us, for the global world, the global south and the global north. Why don't we dismantle that table and build a new table where all of us, irrespective of whether you are black or you are green or you are blue or you are purple or you are red or you are white, all of us fit with a global perspective we are looking for. We are looking for global solutions that are equitable. If we are doing that, we are not thinking about inviting. Why are we inviting? Why don't we build the table together?
You're listening to Patterns and Meaning, a podcast by Seed Global Health. We find meaning in patterns, connect history to the present, and illuminate the way forward in global health. I am your host, Edem Tokunu. Today's guest is Angela Nguku, founder and executive director of White Ribbon Alliance, Kenya. Angela is a passionate maternal, newborn, and adolescent health champion. Her career spans over 15 years of dedicated work towards ending preventable maternal and newborn deaths globally and amplifying the voices of marginalized populations in Kenya, throughout Africa, and around the world. Welcome to Patterns and Meaning, Angela. We're excited to have you on the show.
Thank you so much for having me, and I'm also glad to be in the show.
Great. So can you share a little bit about your background and what got you to start the White Ribbon Alliance in Kenya?
Thank you so much. My background, let me say I'm a graduate midwife by profession, but then went into the aspect of global health, worked in marginalized communities across board, but I was moved by what I've seen amongst women and girls, especially pregnant mothers, pregnant women, and the difficulties they experience especially during childbirth and during pregnancy. And I witnessed so many deaths in different parts of the world. I was privileged to work first in South Sudan, post-conflict South Sudan. Then I've worked in other spaces in war-torn countries, in conflict areas, in marginalized areas, and I've seen the difficulties women and girls go through, including in my own country. And really that got me thinking, if no one is really speaking about the voices and highlighting the issues and bringing and profiling them and bringing them to the fore so that people can actually understand the realities of women and girls, then who will? I mean, things will continue going on as they are. And that's what drove me to start a movement to actually make women and girls' voices count and bring them to the forefront. And that's why I came together with like-minded people. And I founded White Ribbon Alliance. My peers always wonder why I left a very high-flying job at the global arena, but I thought it is much better to speak about the voices than just to continue business as usual and assume that I didn't want to be counted as just anyone else. I wanted to make a difference in people's lives, and that's why I started the movement here in Kenya.
Awesome. And what are some of the ways that White Ribbon Alliance, because in your work, you've been holding governments accountable to what they commit to when it comes to healthcare, especially maternal health. So what are some of the ways that you hold governments accountable and make sure that they follow through with their commitments? And how can other countries learn from your work?
Let me say it's not easy, but again, it's not rocket science. It's about ensuring that there's dialogue, ensuring that at least first and foremost, building the power and agency, giving voice and agency to communities, because it is not us, because we are a network, we are a movement, and our movements work through people. It's about making people realize that they have rights and entitlements. It's about basically simple things like helping people understand what are their rights to health in the Constitution of Kenya, because that is our starting point. Helping people introspect, self-organize and self-advocate. And actually, now again, coming on the flip side, bringing the duty bearers to the forefront with the communities to sit together and come up with modalities of ensuring that whatever is committed to is actually actioned. I cannot tell you it's easy, but it's a journey. And then it's being non-antagonistic. It's being actually bringing to the fore realities of what is really going on. What are the communities going through? Another way we do it is through collecting evidence. And I will talk through a campaign that we went through globally as White Ribbon Alliance, knowing that White Ribbon Alliance is a global movement. We came together and decided to speak to issues around what does quality reproductive healthcare mean to women and girls. The What Women Want campaign was about collecting the realities and voices. And in Kenya, it really spoke to me because I have just witnessed a report launched in 2018, February, that spoke to the realities that most of the women and girls who die in Kenya die as a result of poor quality of care. And if that is the case, then we needed to understand what is the definition of quality and care from women and girls' perspectives. And we went out to ask women, 120,000 women in Kenya, we asked them, what does quality reproductive health care mean to you? The one simple question that we asked actually brought the reality of what quality care means to women and girls. And as we present these realities to the government, as communities speak out about their issues, then they actually realize that what they have been pushing as investments, what they prioritize in their planning and policies is not what women and girls want. It's actually bringing the realities from the community to the government so that money goes to where it's needed. I mean, simple things like women and girls telling us we want respect and dignity. We want to be called by name. We want, when we go to a health facility, we want to find smiling health workers, not to be like almost like pushed around like cows. We want to be called, we want to be explained to simple procedures. We want to go to a health facility and find clean linen, clean toilets. We do not want to share beds. Simple things that government don't think, because every time we go to government and ask, what do you think is a quality definition of quality healthcare to communities? They tell us it's about building new buildings, new health facilities, employing more health workers. It's about they always think macro. Communities think micro, because that is what really matters to them, and that's why they are not utilizing health facilities. They want to go to a health facility and define quality by themselves. Basically, what they are saying is that they want their voice to count in decision making, and to us, I think that is what has really been the deal breaker, because then that has moved the whole thinking, not just governments, but around even donors. How do we think what communities need? How do we even now start shaping funding based by the realities or voices and lived experiences of communities vis-a-vis what is assumed or presumed and already taken and tailored to taken communities? More to that, we believe in the feedback loop. If communities sit with their government, whether it's local government, whether it is health workers in a health facility, or whether it's the broader national government, we track the commitments and we come up with checklists, we come up with action agendas from both sides, from the government, from the communities. And is this tracking that we do, that we go back after every 3 months, for example, 6 months? What did we agree that we were going to see? The community had a role to play. The government had a role to play. The health workers had a role to play. Where are we? We track. So our monitoring, we monitor and track those decisions. And that way, when we see communities working together with their government, well, with their duty bearers, because even service providers are duty bearers, with their ward committees and the like, then we know progress is being caused. There's progress. But if we just do it the other way, the programming way of let's go count the numbers, then at the end of the day, we'll keep on counting numbers and expecting different results. But that will just be for ticking boxes. It will not be for the realities and the realization of what exactly communities want. Yeah.
Thank you so much for sharing that, Angela. It really is working with the communities and basically tracking and making sure that it's what they want and involving them in the process. And so what I want to ask you is, how do you make sure that the success indicators of projects and initiatives are not just ticking boxes, like you said, but are measuring what matters? And how should the success indicators be developed in the first place? How do we shape them?
I think success should be defined by the user. A lot of times, and I'm saying this because I've worked in the programming space, I've been in the global health space, in the public health space, in the development space for quite some time. And how we define success is when we go to the field and do our own evaluation, we send our either external or internal evaluators to go and evaluate. But these are people sitting together to actually tell you what they want. And so success to them is when these things are realized. So it's again sitting with them, because at the end of the day, I believe communities should be able to hold programs to account, and programs to account to actually measure whether the outcomes that were set were defined by them and were actually set to be done were actually done. So if success indicators should come from the same people themselves, should come from the communities. If, for example, taking from the What Women Want campaign, if women and girls told us that we want clean toilets, we want disability-friendly latrines, for example, we want disability-friendly delivery beds, it is again going with the communities and actually cross-checking and seeing, is this actually the realization? Do we have clean toilets? Do we have clean beds? Are they being called by name? And actually now taking stock and asking ourselves, then what does that result into? If that has been done, has that resulted in increased delivery, for example? Is there increased utilization, for example? Is there increased participation? Is there increased responsiveness? by the government, I will tell you for free that it's not going to be the business as usual. It is not business as usual. It is about coming up with hard qualitative indicators to measure. And I will tell you this is not something that funders or governments want to see, want to measure. They want to measure the easy to reach. They want to measure and say, I provided 10 beds, irrespective of whether they were disability friendly, whether they were working or not working, whether those beds are needed or not. To them, that is what they want to see. But going further to ask, did those beds that you brought, were they friendly to the user? Were they clean? Did they have somebody to actually maintain those beds should they break down? Is that, if we build a health facility, is that health facility well staffed by the numbers, the quantity in terms of numbers of health workers who are disaggregated by the need, not just nurses alone, doctors alone, because we know this is a healthcare team. If so, are those health workers having clean running water? Are those health facilities, are those health workers friendly? And that cannot be determined by you who has provided. It has to be determined by the recipient, the user. And they have to tell you frankly, and you have to learn to listen. Not come up with your prescribed toolkit or indicators, the checklist of indicators, and decide this is how it looks like. They need to be allowed to have their own checklist based on their needs, and actually checklist and come back and tell you it's working. And of course, if you see the outcomes, the maternal health outcomes in my case, going up or improving or reduced deaths and disability, then at the end of the day, you know you're moving. But as long as you are the judge and the jury, unfortunately, you will continue waiting for the same results. I mean, that's what they call insanity. Doing the same thing over and over again and expecting different results. It's not going to happen.
Awesome. This season of the podcast is focusing on colonizing global health. Now, with the work you've done so far, what would you say are the ways that colonial influences have shaped how health-focused initiatives are developed on the continent and influence what does and doesn't get funded? Now we're talking about funding.
Interesting. Honestly speaking, every time I talk about this topic of decolonizing global health, I get excited because I'm glad that we're actually talking about something that is really dear to me. Because if you look at the funding and the way the mechanisms of funding have been shaped across board since global health movement or our global health development started, it has all been to serve the masters, the colonial masters. And I am never afraid to say that because it is all dictated from the top. It is all dictated from the West. It is all assumed that whatever is working in the West, whatever is white-skinned, is actually the right thing. It's what sells. It actually does not acknowledge it's development or it's funding that is looking to bring what is working in the so-called global north. I don't know where those terminologies came from. I feel like it's also a way of showcasing that we are more superior. It's actually showcasing like our education, our medicine, our thinking, our models are what should work for you. It does not give a space for the realities and the knowledge, the context, the expertise that we have in the global south, and I would say global south in quotes again, to actually be acknowledged. It silences the expertise. Whatever is here, it's basically, let me say, it is a colonial hangover. It speaks to the fact that, yes, we worked hard and independence was gotten in this the so-called global south, whether it is in Asia or Africa or Latin America, but tries to bring now what works for them, what works in the global north, to be replicated in global south without looking at the realities of the global south and without acknowledging that actually the global south has so much to offer on the table. So it basically puts we are the colonial, we are the masters and you are the slaves. We are the givers, you are the recipients. And so as recipients, you have no place on the table. It is us who have the knowledge. It is us who have the know-how. It is our research that we should be, and it's more superior. Yours is inferior. And that modality, I think, is why it has kept the things and the status quo the way it is. And I don't think it is I think it's deliberate. I cannot really say that it's not deliberate, because if these models have not worked, but we keep on feeling and leaking bucket, they are not working, but we are not ready to shape it. We are not ready to build back better. Then at the end of the day, are we really thinking development? So I call them colonial hangovers. The colonization came, took everything, colonized, took everything, took it away. But now, because you left with nothing, we left the place with nothing because all the resources were taken. We are coming back, trickling small resources, but still coming up, continuing to colonize you through our funding, which is in most times not sustainable because it's very short term, does not look at the realities, does not look at the needs, does not look at the expertise that is here, does not place the voice for the need, the African on the table or the global south on the table. It's actually just guided by the West. So for me, those models are the ones that are really, they are perpetuating the same models which are not going to work. And I will finish by saying, until we change that narrative, until we reset the button and actually ask ourselves, why did we find ourselves here? We have to, until we look at the past in terms of how did we find ourselves in this place? We will continue really doing business as usual and expecting different results, and again, getting nothing at the end of the day.
But see, Angela, these things, I mean, the reason why they get to dictate or they come up with these models is because they have the money and we don't have the money. So where are we going to, how do we start like basically raising money here? Or how do we start coughing up the money here for what we need so that we can say to them that we're not taking your money, or we will take your money, but we want to use it in this way because this is how we need to use it?
I think I'll answer that with starting with 2 questions or 3 questions. Number one is, or 3 food aspects of food for thought. One is to ask ourselves, how did they end up having more money than us? They were the colonial masters, number one. So the past cannot be forgotten. So before we can even thinking about that, we should, all of us, whether it's a global south or global north, they have the money, but how did they end up having the money? It is about the colonization that took place. What did colonization give back to? It gave back to racism, it gave back to sexism, it gave back to inequilibriums that are existing at the moment. That is number one. Number two, they have the money, they have it go all these other aspects that are not conducive to how we are thinking and gives us a lesser place on the table. But we are talking about equity. We are talking about the SDG agenda. We are talking about equality. We are talking about ensuring that every voice counts. If we really mean that, it doesn't matter whether you have the money or you don't have the money. It means being honest enough to say, yes, we have this money. The past, we got this money because of the past and the colonization that took place. Now we want to come together and sit all together on the table and make it work. You see, it might have the money, and you might have the money and do like business. I have the money, so I'm going to run a business. It is not a business. You are saying that you're on your global health because you want to build back better. You want to make things work. Then you have to stop them. You have to appreciate that it's not just money that counts alone. Where did the money come from? And where did the money come from? The resources. So what do we need to do to rebuild what we already broke? So not looking at it like I have the money because I worked so hard for it. I have the money because I colonized this side of the world and we got the resources. So how can now build back better? Drop that, reset the battle, build models that are actually going to ensure that all this that happened during colonial days is actually working even for the people, for all of us. I am telling you, there's a time that the world has been taught a lesson is during this COVID pandemic. All of us are in it. And so that tells you that whether you have the money or you do not have the money, we all will suffer at some point if this continues to happen. So then how do we work together as a world to ensure that the realities that we are all living in, because it's affected all of us, how do we ensure that we work together? We are all on the table because we have expertise, we have knowledge, we have models, we have indigenous knowledge, we have education that is, it's not inferior. All of us have that. We need to ask ourselves hard questions. We need to ask ourselves, what are we willing to trade? What are we willing to do? If we are honest enough to say we are investing for the betterment of the world, then we have to be honest enough to ask ourselves, then how do we do it? And do it without strings attached. That's what I would say.
Okay. Most of the time when you hear conversations like this, people would say that invite Africans to the table, invite African health workers to the table, at the decision-making table. I want to flip this a bit. Apart from inviting African health experts to the decision-making table, where you are thinking about funding, the initiatives you will fund, the models you will use, basically like re-looking at the whole model, what, apart from inviting experts, what are the tangible measures that can be taken to ensure that African health experts are actually being listened to and that global health is becoming more equitable? So now we're looking at practical 1, 2, 3. These are the kind of things that we can do.
First, I think the word inviting Africans to the table, I think is misinformed. It's not about inviting Africans to the table. Why don't we create the table together with the Africans? Why are you inviting them to the table? Why don't we all agree, like we are actually creating this table together? And we find that the current tables are not fit for all of us, for the global world, the global south and the global north. Why don't we dismantle that table and build a new table where all of us, irrespective of whether you are black or you are green or you are blue or you are purple or you are red or you are white, all of us fit, because a global perspective we are looking for. We are looking for global solutions that are equitable. If we are doing that, we are not thinking about inviting. Why are we inviting? Why don't we build the table together? Because the current tables are not working, the current table are not fitting, because they already dictated who sits on which side of the table. And so instead of now inviting other people, and then we start bringing stools and all that, and we're talking about equity, why don't we create a longer table, a bigger table, dismantle the one that we have, bring a table and then bring everybody, whether you're African, whether you are Asian, whether you are Caucasian, whether you are Latino, you bring everyone on the table, let's make things which work for all of us. And for us to do that, then that means that we need to rethink. We need to rethink our models and be deliberate enough. It's a word I don't like because it's being overused or misused. Appreciate and acknowledge that there's a problem somewhere to start. And that problem came because of the way the past, the history has shaped the way global health is funded. And looking at that, appreciating that all that has even changed the way disease, for example, disease burdens, disease trends, the way health is organized, even across board, even in the governments that you are working with, even in education, even the way health education is delivered, because it's delivered to look like if you got a degree, for example, in Harvard, or you got a degree, I'm not saying Harvard is a wrong place, or you got a degree from the Western world, it is much superior than if you got a degree here. It's appreciating that the knowledge, everything that needs to be decolonized, everything from our thinking, from our actions, from our funding models, from our funding mechanisms, from our research. Because I mean, a lot of times you hear that you are actually taking part in a research project, and who becomes the other? The one from the West. The rest from the other African countries become the data collectors. It's accepting and appreciating that all of us, we have the knowledge. I mean, we need to ensure that at least all that is decolonized, and then we start from a point of equity. And that's why I'm saying we need to reset the button before we can even start thinking inviting. And so it's about being honest enough and introspecting if we want change. Because if we all want change, then we all should be ready to for that change. So I think first is to start asking ourselves, where did we start? And then the other thing that we need to ensure is that knowledge, no one is as the full custodian of knowledge. No one as the full custodian of know-how. All of us have something to offer on the table. And so it's I think about breaking the current power barriers, breaking the power barriers that come along from money, from of course the past histories that I talked about, and actually appreciating and acknowledging that we all have a role to play in shaping the global health agenda. Yeah.
Thank you very much, Angela. These are very insightful words and gems to just munch on, think about, and apart from just having conversations, we need to start being very practical about this thing. Enough of the theory, enough of the talking. We need to start working. Yes. So what would be your pattern words to people listening to this podcast? What advice would you like to give them? What would you like to say to them to start doing things in their corners that they are in? The podcast has all sorts of people listening to health workers, the funders, the investors, the recipients of the healthcare. So what words do you have for them?
I think the word I have for everyone is that we all need each other, and there's no superior and inferior. We all need to appreciate that real impact in global health and development will only happen when we are honest and realistic enough. We listen to the realities and we fund, for example, if we are donors, we fund what is needed. we stop drumming up our own business into people's agendas and let people set their own agenda. And then from there, we can decide what needs to be funded and prioritize what needs to be funded. I think the other thing is to actually be honest enough and realistic enough to appreciate that we are living in models that are inequitable, and there's an equilibrium at the end of the day. And what that means is that there's a group of people, or there's a group of populations that are seen as inferior and appreciating. And I think that is something that everyone is really realizing, that at the end of the day, even within those populations, there's also the gendered aspect of it that we also need to be very deliberate about. And more to that, I think we need to let people or let populations decide what is really important. And if we are honest enough that we want to build back better and make things work, we need to appreciate that there are groups even within those populations that need more focus than others. And there's no better voice. Every voice counts because every voice has a stake on the table. I think the other thing that we need to appreciate that for the longest time, development has been very manipulative. It has been and be honest to ask, to introspect and see how that has been, because it's very easy to point fingers and say, no, it has not been. Even for people in my side of the world, we need to be realistic enough and ask ourselves, because I don't think we are any better, because if we continue allowing the status quo to continue and allowing that kind of thinking, we need to be able to speak up more and say, yes, this needs to change. And even governments need to speak up more and needs to actually ask themselves whether this is what is needed, and allowing the people decide what priorities are needed. And then when now the development world comes in, we say, these are our priorities. I don't want to push the blame only to the north, but even in the south, what are we doing to actually shape that development? What are we actually doing to ensure that development is shaped? Because if no one is speaking about it and no one is talking about it, then it's very easy for us to continue the same thing because it looks like it's really working. More to that, I think also for the global south, the aspect of corruption amongst our governments is something that needs to be called out. We need to call it out, because it's a form of corruption that you keep on allowing something that you know is not a priority for your people, but because you just want money at the end of the day. But more to that, and on the flip side of that is that I think the funders need to stop funding or basically filling a leaking bucket. If you know that there's corruption, and that one has been proven in many times, and I can speak very strongly in my country because there have been cases of corruption, many of them, don't continue putting money there. Ask for accountability. And I think funders now need to start looking to fund movements, to fund social groups that are really calling out accountability, because again, it calls for money. It's about advocate accountability, and that is long-term, it calls for money. And that's all. I think funders also need to start looking at what are those aspects at community level that bring about the aspect of voice and accountability, such that at the end of the day, what is being funded in health should actually be received by those, should actually go the last mile and ensure that those who are supposed to be receiving it, receive it. Because we have seen a lot of times, even in a time like this of COVID, where we have seen corruption, money that is meant or that is sent to a country like Kenya for fighting COVID, being taken up by, being redirected to other things because of corruption. And then until we be able to fund movements and groups to be able to actually fight that and actually call out and stand out and say no, then we are not going to get more. So I think donors need to be deliberate, or funders need to be deliberate when they are funding health. Not just funding the service, but also fund accountability. So that at the end of the day, where that money goes, it's actually monitored. There's transparency, there's accountability. And at the end of the day, then it reaches the last mile, as I earlier said. Yeah. But as I think the other thing is about being deliberate to break the power barriers, being deliberate to ensure that at the end of the day, we don't just doing the same thing. We take a moment, a break, and think, what has been the problem? Why are we not progressing? Why are outcomes not changing? And then and being deliberate again about the past. How has our past? How has history shaped the way development is shaped, and what new models need to change? And even if it means doing away with the old models and starting afresh, then so be it. That is what is really going to change the global health arena.
Wow. Thank you so much, Angela. This has been insightful. So many insights. I love the no holds bars approach. Just telling it as it is, and calling out who needs to be called out. So, thank you very much.
Yeah, thank you.
And there we have it, folks. As Angela said, in our bid to shape the global health arena, we need to ask the tough questions about how history has shaped the current global health systems. Funders need to start funding groups that are calling for accountability from funders themselves and from the recipients of the funds. And if doing away with old models and starting afresh is what we need, let's just do it.